Perfect. All right. Well, I'm John Mietchen. I'm a neuropsychologist here at UW Kids. I work in the Department of Neurology, kind of in their outpatient clinic, but I also staff the brain care clinic where we're seeing a lot of these kids.
And I'm Karen Carpenter. I'm a rehab counselor. I work both inpatient at the Children's Hospital and staff the outpatient brain care clinic, and also I'm in a variety of other multidisciplinary clinics. And I'm here to support families with providing resources and assistance and guidance and anything related to school, returning to school, getting resources. So it's nice to meet everybody.
Okay. So as far as the outline for this presentation, I think my main goal is to kind of identify or talk about some of the common things that school-aged kids might struggle with from a neurodevelopmental perspective. Also, I think my goal is to kind of talk about how do we identify those things as parents or caregivers or people who are kind of involved in these kids' lives, and then kind of towards the end, Karen is going to kind of talk about different ways to kind of get schools involved to make sure we're supporting your kids as best we can. So first, we're going to talk about some of the neurocognitive and academic challenges that we might see, and so that's going to include things like attention, processing speed, executive functioning, and then we'll also talk about how those things might affect things like reading and math and writing. I'll touch on some of the emotional and behavioral or mental health outcomes that we might see in some of these kids. And then I'm going to talk about kind of when should we consider neuropsych testing. So let's start by talking about inattention. So these things that we're going to talk about, kind of similar to the last presentations, can look different in a lot of kids. Some kids are going to struggle in different ways, but as far as kind of the things that are going to be the most common that we'll see, the inattention, having trouble with executive functioning, we'll talk about that too, mental fatigue throughout the day, and then just kind of like slower processing speed. Those are going to be really the most common things that we see from a cognitive and kind of like a thinking skills standpoint. So what does inattention look like in school-aged kids? I think the most common thing that we're going to at least think of is going to be, having trouble staying focused. We're getting distracted easily, especially on things when we're supposed to be doing like independent work, whether that's school or chores, cleaning our room. But they might appear kind of like daydreamy. Another word I hear a lot is like spacey, right? We might just kind of like space out, and we're kind of lost in our own thoughts. We might miss instructions, and so a lot of times some of these kids might look forgetful, but they're not actually forgetting. If you kind of ask them what are you supposed to do, they can actually answer what they're supposed to do, but they're using the term I forgot a lot because they're getting sidetracked and they're supposed to be cleaning their room and they found a cool toy they forgot they had, and now they're kind of stuck on that. So and then another thing that we can see with inattention, there's kind of a phrase that people will use. The kids who struggle with attention can be consistently inconsistent. So, right, like one day it's like, man, like we really hit those flashcards today. It was awesome. We did a great job. And then the next day it's like, how did we forget everything? And it's usually actually not a memory issue. It's that our attention's not regulated enough. It was regulated yesterday for whatever reason, and then today it's not. And our performance is just really inconsistent. Needing a lot of redirection. And I think in the younger ages, really what we're looking for even is in like routine. Right? I think a lot of kids are just going to need some redirection for new kind of novel tasks. But if it's like, man, we do the same routine every night for bedtime, we do the same routine every day before school, and it's just a constant like, have we done this? Have we done that? Right? And just kind of making sure that we're keeping them on track. And then incomplete work, or sometimes what we see is like, this is boring, so I'm just going to get this done, and we're making kind of some careless mistakes along the way. Let's see, so what can slowed processing speed look like? I think this is one that it's kind of in the name, right? It just takes longer. So oftentimes these kids, they can problem solve, they can learn, but when it comes to just kind of executing a task, getting something done. It's just taking them longer to do. And so having a hard time keeping up with the pace of the classroom. I think as kids get older, note-taking can be a big thing where like we just can't keep up with the pace of the class. And so we're missing information. Needing extra time to just think through something and provide an answer, even though when they're given that time, they can give the answer. Performing better on untimed tests or activities than when there's a time limit. And just kind of feeling kind of overwhelmed when information is presented too quickly. Or we can see that just the accuracy of a task drops when they're asked to work faster. So executive functioning is kind of an umbrella term for a lot of different types of skills. Right? So if we think of the things that like, I'll explain like, what is a CEO's job if they're an executive of a company, right? They're supposed to be planning ahead for things. They're supposed to make sure that the organization is staying organized. People are kind of doing the things they're supposed to be doing. They're supposed to make sure that they're prioritizing things, right? This needs to be done first, and then we do the next step. And if we do the second step first, so we've got to go back and start over. So these are the kinds of skills that we're talking about with executive functioning. And so some of the things that we see when kids are struggling with executive functioning is just a skill that we'd call like task initiation, right? Something's got to get done and like there's just a block. We just can't get past like just getting started. Again, having trouble planning, organizing, breaking things down into smaller steps. As kids get into school age, especially, most teachers are pretty on top of most kids in elementary school, but certainly once we hit middle school, we start to see just a lot of incomplete work, missing work, and you might look in their backpack and everything's done, and it's just never got turned in, or it's mostly done and didn't get turned in, late assignments. Again, as kids get older into those teenage years, we might see trouble with like poor time management. Or becoming overwhelmed by multi-step tasks or requiring just a lot of external structure to kind of keep them going throughout kind of like routine days. And then another one we see that is pretty can be pretty specific to this population too is just mental fatigue. So it's not necessarily that there's an underlying neurocognitive delay, or sometimes it's both. But we can just see that we're just having that mental fatigue throughout the day. So are we noticing that maybe in the morning it's not that there's a attention issue all the time, but kind of towards the end of the school day, our attention is waning a little bit? Are we more irritable or emotional or frustrated as the day goes on? Again, are we kind of a little more off task as the day goes on? Do we need more breaks or adult support to complete work? And then if we're just noticing that our work quality deteriorates throughout the day. And so a lot of these kids, they're just going to have rough afternoons in school. And so, something, I don't know if we have a slide on this, but something to consider is like having kind of those really core classes early when we're kind of at our best, and then some of those not extracurriculars, but kind of the, less core classes, later in the day. So I think I just kind of wanted to focus on what are some questions as parents we can ask ourselves to really know, like, is this typical childhood, or is this something I need to maybe bring up to my doctor because we're noticing some challenges? So within attention, again, are we missing information because they're not focused, or because the environment is asking more attention than what they can realistically give? And I think with that, usually we're talking about a classroom, and most classrooms do a pretty good job at tailoring it to a typical child's developmental level. So if they're in first grade, most first grade classrooms are going to be targeted to, or kind of, approached in such a way that most kids are going to be able to focus. And if we've got someone who's not able to, we might be considering, talking to our doctor about something like that. The second one, probably a better way to phrase this is this a child who just needs a lot of that one-on-one support to just stay on task? With slowed processing, does my child understand the material but struggle when they're expected to work quickly? Or if time pressures were removed, would my child's accuracy and confidence improve? Does my child know what to do but struggle with getting started, staying organized, or finishing without support. So these are questions to ask about executive functioning challenges that we might see. And then, does my child just need a lot of that adult scaffolding? Do they just need a lot of that adult support outside of them to make sure their life is kind of staying organized and on track? And especially as they get older, they should be able to start taking on some of those responsibilities on their own. But if they're struggling to do that, that would be something to think about talking to your doctor about. And then again, mental fatigue. Does my child's performance or emotional regulation decline as the school day goes on? Or is my child working harder than peers just to maintain the same level of functioning? So let's talk about some of these academic skills. So we can see, it's not impossible to see trouble with decoding. Decoding is just breaking up the sounds in a word and pushing them together, right? So most of the time we're going to just refer to that as like sounding out a word. That's kind of what we think of when we're decoding. We can see that in kids with CHD, but oftentimes what we're seeing more is comprehension. And a lot of these, again, it's not that there's even an underlying comprehension impairment or deficit, it's that their processing speed is slower, that's going to affect our comprehension. Their attention span is waning, that's going to affect our comprehension. And so a lot of these are still rooted in some of those things we just talked about. It's just that they're presenting specifically with some of these academic skills. So again, the big thing with comprehension, are we having trouble summarizing what we read, answering questions about what we read? Oftentimes we'll just ask, like, can you answer some of the WH questions about what you read? Who did this? Where did they go? What happened? And if they're not able to answer those questions, we're probably looking at some additional supports. And then again with math. So oftentimes it's not necessarily that they are just completely confused with just a term that we call number sense, which is just how numbers work together. Oftentimes that's not where these kids are struggling. It's with like multi-step math problems, right? That executive functioning. You've got to be able to sequence a math problem in the right order. If you start with step 2 and you skip step 1, you're going to get the wrong answer, even if you know how to calculate the numbers, right? So we can see a lot of that, executive functioning, processing speed, and attention really affecting kind of our math performance. And then writing. So this is a big one, I think, especially as kids get older, right? So writing is a really complex skill, and you have to be able to sort of access your vocabulary while you're doing it. You've got to be able to focus. You've got to be able to do a skill that we call like working memory. You've got to be able to hold a couple things in your mind at once. You've got to be able to organize everything. And so, yeah, it's a complex skill, and we want to make sure they're getting the support we need. So are they having good ideas but can't get them on paper? Are we shorter incomplete responses, disorganized writing? So some questions we can ask ourselves, right, with reading comprehension. Do they understand what they read, or are they just reading the words? Can they remember or summarize a story? Are they having trouble keeping problems in their head while they're going with math? And do they get stuck when problems involve more than one operation? And then with writing, are they having trouble getting their ideas on paper, organizing their ideas, or are they just kind of getting really mentally fatigued during a writing assignment? So with mental health, I think the big things that we're looking at really are depression and anxiety. And I think the big thing with anxiety, the kind of the hallmark feature is worry, right? Are we kind of a nervous kid? Do we worry about things a lot? Do we have trouble controlling the worry? And then with depression in kids, we're talking about sadness or a lot of irritability. And some of that irritability can cross over into anxiety as well. So I think some questions we just want to be asking is, has my child's mood, worries, or behavior changed so much that it's affecting their school, friends, or family life? Does my child seem sad, irritable, or on edge most days? And not just once in a while? And am I spending more time trying to calm, comfort, or manage my child's emotions? Okay, so I'm going to kind of go through these quick. Okay. I'll pull my, okay.
Speed up.
Okay.
You're fine. You're fine.
Okay. Perfect.
I have less slides than you, so you're
Okay.
fine.
Okay. Well, then I'm going to take my time.
Take your time.
Okay. So why do we want to pursue neuropsych testing? So one is that for some of these things, it is hard to know if someone has an actual disorder or disability without testing, right? So usually you don't need full testing for things like anxiety or depression, right? But if we're trying to parse out, is this a processing speed issue versus like an actual reading comprehension issue? Usually you do need testing to help kind of parse those things out. And so that's kind of part of the reason we're doing testing. And if they do have some type of learning disability or, neurocognitive delay of some kind, testing helps us see which ones. And the purpose is not to just identify a label. It's to often some of the labels actually do help us with knowing what supports they need, right? So if it is something like ADHD and we can call it ADHD, then we know what kinds of supports they need in school, what types of treatments options are going to be available. And so the goal of any kind of diagnostic label is to help with treatment planning. And then certainly testing helps identify strengths as well, that if we have certain challenges, we want to really be leaning on those strengths, and testing can help us identify that. And then again, it can help us with recommendations and accommodations. So what does a neuropsych evaluation look like? So typically it's going to start with a clinical interview where the neuropsychologist will talk to a parent and the child together, and then usually I'm going to want to, at least for myself, I'm going to want to talk to the parent one-on-one at some point. And so a lot of these we're doing, if it's a more comprehensive evaluation, telehealth, but for the brain care clinic, we'll get a chance to talk to the parent one-on-one while the kid is actually doing some of that testing. The testing itself is usually going to be kind of play-based or brain games. Do some blocks, look at some pictures, ask some kind of like riddle type questions. And really what we're trying to measure are things like, we want to make sure that their IQ is developing appropriately, their language is developing appropriately. And then we're also going to kind of really focus on the things we talked about here. So that attention span, processing speed, some of that executive functioning. And then, or kind of those more comprehensive evaluations, that's where we're going to be looking at some of those, kind of doing a deep dive into some of those learning activities like decoding versus comprehension, math problem solving, that sort of thing. And then kind of at the end of that, usually in the brain care clinic, you'll get feedback that same day. If it's a more comprehensive evaluation, you're usually getting feedback about a week later, and then a comprehensive report is going to follow that. Okay. And then how do neuropsych test results help us? So they are really going to help us with educational planning and linking test results to tailor a child's IEP, 504 plan, or classroom supports to what they need, right? So that really is going to look pretty different kid to kid because every kid is different and what they need is going to be different. It can help identify if we need any additional like mental health supports. Is it something we need to be seeing a therapist for? If so, what kind of therapies might be the most helpful? Is it something we need to be considering like a consult to psychiatry about, or talking to their PCP about medication options? And then different family and home strategies. So how can we help kind of build routines to help support things like attention and organization, and supporting independence at home while also kind of helping to kind of scaffold and support them where they need it.
So as Dr. Mietchen just said, there are a variety of cognitive domains that can impact school. Some, as he said, every child is different that has CHD. Some have many of these and some maybe only have certain ones. So we just want to kind of be mindful when we're working with the school of how cardiac conditions can affect school. One of the first ones is fatigue or lower stamina or lower endurance. Some of these kids may be making it through a whole school day is tough. So maybe some of these kids may have a little shortened day or maybe come in school a little bit late in the morning. They may need a rest break, or we may need to modify their activity during the day. Even at recess Can they do something that's more calming with a friend? Can they have some modification to their PE class? Some of these students need medications during the day, and also they have more absences than other children. They may have doctor appointments, outpatient therapy appointments, counseling appointments that take them out of the school day. Oops. So why school planning matters. Importantly, we want those children to be in school just like all the rest of the students, but we want to keep them safe. So we really want to make sure that we're having really good communication with the school, so they are on board, knowing what the conditions are, and ensuring that they understand all their medical needs. Some students with cardiac conditions have an individual healthcare plan that's strictly just for their medical needs, so the school knows what to do in case something happens. Then there's other children that we'll talk about that need more of a support plan to support their academic learning, be it, and I'll talk about an IEP or a 504 plan. And that overall just kind of reduces the stress for parents. Like, as you know, like going through, children with cardiac, it's a very stressful part of their life, and we want to do everything we can to just kind of alleviate that stress. So there are a few services schools can offer. One is a 504 plan, which is basically from Section 504, more of an accommodation plan. It's an access plan. It looks at what do they need to do during the day to support their learning, be it I need to use an elevator because I'm just so tired. Does it mean I just need to sit in the front of the class? We look at in this, I think of the words as how is the material taught, not what is being taught. An IEP, on the other hand, is a very structured, criteria-based, eligibility-based plan. The parents have to request and go through an evaluation. And to qualify for an IEP, you need to have you need to document that your child's education is being adversely affected, and you need special ed supports, and you need services. And they look more at what is taught. How can we tailor the curriculum based on all the things Dr. Mietchen just talked about? Do they need curriculum modification? Do they need more tutoring for reading? Do they need math tutoring? So it's basically a plan that supports their instruction. Many kids with CHD fall under OHI, which is other health impaired. That's one of the 13 impairment areas, kind of looking at someone who's going to have a long-standing condition that affects their learning. So everything has to come back to how it affects their learning. Parents can do this easily by requesting and writing their intention to ask the school for an evaluation, and that's something that we can help with through the brain care clinic, is kind of helping them with a template, helping them understand the process, helping them write the letter if they need to send to the school. These are common school supports that we see, and the first one is that rest break. Some kids need a little bit of school and then need a little rest, and then need to go back to class and need a little rest. Or flexible scheduling, like I think Dr. Mietchen alluded to. We want to make sure maybe all their core hard classes are in the morning, because that's when they have the most mental strength, versus late in the afternoon. Or flexible scheduling, maybe they need to start school an hour later, or an hour earlier they leave. Modified PE class or recess, what can we do to support them? We want them to participate just like all the rest of the students, but maybe they need a little bit of modifications. Kids who have slower processing speed, we look at extra time for assignments or tests. They know the information, they just have to take a little bit longer to process it. So we want to give them a little bit more time, or we want them to take the test in a quiet room so that they can really focus. Flexible deadlines, that can either be because they cannot get everything done at the same time, or they have appointments and just need a little bit more flexibility in their day. We want them to be able to have access to the school nurse throughout the day, and looking at lots of technology, like anything from voice to text, audiobooks, breaks during the day we've already talked about. So communication is really one of the main keys. We want to always be on the team and sharing medical updates with the school. We would like to identify a key person that's going to be your go-to as a family member that you can talk to about anything, and they kind of understand your child from the beginning to the end. They know everything about that child, so you don't have to go back and, oh, do you know that they had cardiac surgery when they were younger, and this is some of their limitations, and this is some of their medications. It's that point person that knows what's going on. And for sure, we want to plan ahead for transitions when you're getting ready to move to middle school or high school. When demands are going to change, we would like them to have a nice transition plan set up to help the families prepare for the next move. And beginning to work with that student about their learning their own self-advocacy skills. As we know, like every cardiac child's different, even though they might have had the same cardiac procedure, they might not look the same as the person next to them that had the same procedure. We want to plan supports that are going to make them very successful in school, and collaboration is the best thing that we can do. You're not alone. You are part of the decision-making team. When we think back on IEPs, you are a member of the team, and I think a lot of parents forget that. They think that the school is telling them always what we're doing, but they are a team member, and they have the largest voice. And then we'd also like to share some resources that are really helpful for families, supporting them with anything related to education supports. And then I wanted to call out the Children's Hospital of Wisconsin has an EAPP, I think it's Educational Partnership Program, and they have some 2 6-week virtual online classes that parents sign up for, and you can watch them live or you can watch them they're recorded, and it's a wonderful program to walk through parents, how to support parents with children with cardiac conditions. That's all I have.